the normal bacteria of the mouth, when they get into an area, a closed area deprived of circulation, like a root canal, a sick tooth, or a cavitation, they become deprived of oxygen, and they become anaerobic. Their metabolism changes, and then they produce the most deadly toxins for the body.
Hopefully we can stop the production in my mouth and finish cleansing my body out and extend my life a bit here. That's the goal, to live. I was losing brain function a year ago. So this is a big step for me in doing this. I've had amalgam and root canals packed into my mouth. Amalgam since the 50s. I was in experimental fluoride treatments back in the 50s where my sister we'd brush side by side morning and night. She would have 2 cavities and I'd have 22 cavities every 6 months. So I packed myself full of amalgam. We're poisoning ourselves. But this is a major step, getting this out of my mouth. I really feel free having all these old root canals taken out of my mouth and taken care of properly.
There is no doubt in my mind that the energy lift that I have felt and the clarity that I have had since having the toxins out of my system, I have no doubt that what I'm feeling now is a direct result of having the dental cleanup that I did.
My doctor recommended actually that I go see Dr. Behm. I had a serious physical situation going on with my body, supposed to be a terminal illness, and what my doctor found was indications of an infected root canal operation. Say 3 years ago, when I went to first see Dr. Behm, I walked in with a bottle of oxygen. I mean, I couldn't, at times, getting out of bed at night to use the bathroom was an extreme stress, because I'd just be so low on oxygen. I would need many bottles of oxygen a week just to do routine things. Going up a flight of stairs, forget it. This is if I had to, it was a slow ordeal, and then I have to suck a lot of oxygen really heavily. So now I just don't have that issue, right? And this is makes a rather major change in lifestyle to not have to be slowly hobbling around a shopping center trailing a bottle of oxygen.
I would say that I wish I had come to see Dr. Behm a long time ago, and it would have extracted the amalgams, which are 50% mercury, which is one of the toxic materials out there, just to change my physiology, along with reducing the burden on my liver and everything else that's affected by mercury. Every time you take a sip of hot beverage or you brush your teeth, mercury is basically let loose in your mouth. And so as you drink something hot, it becomes a vapor. So I wish I'd have started it sooner. So